and welcome back to another Cafecito con NHCOA. Do you know, according to the American Diabetes Association, 37.3 million Americans are living with diabetes in the United States, and furthermore, 1 in 4 adults with diabetes don't know they have it. Diabetes is a long-lasting disease that affects how your body turns food into energy. There are 3 main types of diabetes: type 1, type 2, and gestational diabetes. Adults have 40% chance of developing type 2 diabetes. But do you also know that if you are Hispanic or Latino adult, your chance is more than 50% you're likely to develop diabetes at a younger age? Nosotros, the Hispanic and Latino community, often face diabetes complications, which lead to higher rates of kidney failures caused by this chronic disease. Complications can also include diabetes-related vision loss and blindness. Many people with this chronic condition will live with it every day. However, advances in health research may lead to better understanding and increased support for people with this condition. Your participation in research programs like the All of Us Research Program can help researchers work towards delivering more personalized treatment and prevention techniques. The future of your health is in your hands. So let's welcome our first speaker, Stefania Acosta Ramirez, Engagement Specialist for Spanish-speaking communities from the network of the National Library of Medicine, or also known as NNLM. She will talk about her organization, how they are involved with the All of Us Research Program, and resources they have available regarding diabetes for Latinos. Welcome, Stefania.
Oh, thank you. Thank you for the invitation to share about the network of the National Library of Medicine, and I will love to have this conversation with you. The network of the National Library of Medicine is an outreach and engagement program of the National Library of Medicine, or NLM. NLM is the world's largest biomedical library and maintains a vast print collection and online resources like MedlinePlus and PubMed, and is located on the campus of NIH, or National Institutes of Health. NNLM is composed of 7 regional medical libraries, as well as several offices and centers. Then we are covering all the territory for our nation. And we are one of those national offices that serve all the country. Then we create this special program that is an NNLM All of Us Program Center that is a partnership between NNLM and the All of Us. NNLM is composed from members all around the country. Then we are providing all the members of All of Us that are working to make this program possible in a training and education platform. But we are working with all our communities in virtual health programs like this one. We are funding engagement in libraries and community organizations, and we are always sharing resources and learning materials for libraries and communities. Then we are here to be a support for all organizations and all the communities and all of you to know more about the program or health information. When we are trying to find good health information, we are going to find all kinds of things in internet and in general in our conversations, and we need to know where to go. Then my first recommendation will be MedlinePlus. MedlinePlus is an online health information resource for patients and families and friends. The MedlinePlus is a service of the National Library of Medicine, NLM, that is the world's largest medical library, which is part of the National Institutes of Health, the library that we were talking about. Then MedlinePlus offers information on health topics, human genetics, medical tests, medications, dietary supplements, and healthy recipes. And MedlinePlus is available entirely in English and Spanish. Then we have a lot of great resources in one website. It's always free. It's ready for you. You never are going to find ads in MedlinePlus. All the sources are like from a trustable fund, and you can print. Sometimes if we are taking care of someone that doesn't have access to our computers right now, or we go to our public library and we can print whatever we find in English and Spanish. These are some of the places that MedlinePlus use to tell you good information. Then coming back to the internet, if we go and find diabetes, only finding results in English. I'm not taking in my like Spanish, that sometimes we do a double search and we find in English and then we go like resultados en español to see what we find. Then we have 3,300 million of results only in diabetes. If I go with diabetes NIH, it's going to be big, but not that bigger. Then we have 203 million results. But there is something. Our top result is National Institute of Diabetes and Digestive and Kidney Disease. Then we are going to find another nice resource of good information that is Institutes of NIH. In this case, we have the National Institute of Diabetes and Digestive and Kidney Disease. Then you see that you can check the information in English or check the information in Spanish, and they will have a live chat to answer your questions if you want good resources about this. I would like to invite you to one of our coming virtual health programs that is going to be open to everyone. We will share more information soon, and you can find the information too once it's ready in the NHCOA platforms and in our platforms. We are going to have an event that is going to be called Caregiving Today. A look at this beta role and what it takes. It's going to be November the 17th at 4 p.m. Eastern Time. We are partnering with 50 Forward and National Alliance for Hispanic Health, one of partners that are working with us like NHCOA, and we would like to have you. We are going to have great speakers, and we are going to talk about needed resources and how the data and experience can help drive needed research to improve our caregiving world.
Thank you, Stefania. If you want to know more about the resources that Stefania just discussed, please look into the description of this video. So let's continue with this important discussion with our next speaker, which is Megan Jula. She's a research program manager at Mary Center, who will provide a brief description about Mary Center, how they are involved with the All of Us research program, and the resources they have available regarding diabetes among Latinos, particularly those who live in the Washington, D.C., Virginia, and Maryland area, also known as the DMV area. Welcome, Megan.
Hello, everyone. Thank you so much for having me. My name is Megan Jula, and I am a research program manager at Mary Center. Mary Center is a community health center. We were founded in 1988 by nurse Maria Gomez and a group of health professionals to meet the needs of newly arrived women fleeing war and poverty in Central America. Today, we have 7 locations in DC and Maryland, serving over 65,000 participants, including children, adults, and seniors from 50 countries. We offer healthcare, education, and social services. Mary Center offers each participant individualized care on the path toward good health, stability, and economic independence. Importantly, Mary Center serves everyone, regardless of their ability to pay. And as a federally qualified health center, we don't turn anyone away. Here on this comprehensive healthcare slide, you can see the wide array of services we offer, from primary care, dental care, nutrition, geriatric care, and much, much more. Our social services also span a wide array and all aspects of the life cycle. And we are very proud to partner with our sister organization, Bria Public Charter School, which offers dual generation education. So while children are participating in early childhood education or preschool classes, their parents can take English literacy, digital literacy, or parenting courses. And Bria also offers high school diploma, medical assistant training, and child development associate programs. Mary Center has been a proud partner of the All of Us research program since 2019. We are currently what's called a direct volunteer partner, supported by Scripps Research Institute. So our All of Us team, which is pictured on this slide here, is a resource not just for Mary Center participants, but also for anyone in the DMV who wants to learn more about the program. We can help answer any questions you may have, walk you through the process to join All of Us. And as a direct volunteer in the program, we'll help you get started and we'll support you. But your involvement is self-driven, it's your choice. And if you decide, for example, to donate a biosample, you could order a saliva kit to your home or schedule an appointment at a nearby lab in the DMV. And the easiest way to reach our team is by giving us a call. You can reach our bilingual program navigators at 202-420-7149. You can then press you can press 1 to speak to a navigator in English or 2 to speak to a navigator in Spanish. And if our team isn't available, please leave us a message. We'll get back to you as soon as we can. You can also email us at allofus@marycenter.org, or you can learn more about the program on our website, which is joinallofus.org/marys-center. We're here and excited to help. So our website is a great resource, and thanks to our social change model at Mary Center, we're equipped to address diabetes prevention, management, and education in a comprehensive manner. So that means we have many teams at Mary Center supporting patients with both prediabetes and diabetes. This includes our medical team, our Partners in Health or Socios de Salud, and My Health GPS care coordination programs, our nutrition team, and our health education team. On our website, we do have bilingual resources at this address here, www.marycenter.org/resources. Under the nutrition section, you can find healthy recipes. There's a really great video on diet for people with gestational diabetes, for example. We also have a collection of blog posts from our staff on our website. I circled at the top of the page where you can easily find our blog posts and search them by topic. There's one in particular I wanted to mention from our bilingual nutritionist called You're Diagnosed with Diabetes, Now What? That offers some helpful next steps. And lastly, you can make an appointment with Mary Center by calling us at 844-796-2797 or completing the appointment request form on our website. And that yellow arrow points to the button for that form.
Thanks to both of our guest speakers and their dedication to supporting NHCOA and the All of Us Research Program. This will be all for today's Cafecito. We hope you learn more about NNLM, Mary Center, and how the All of Us Research Program is making a difference by gathering information about your environment, lifestyle, genes, and health history so researchers can learn more about certain diseases, including diabetes. Please make sure to scan the QR codes that you can see on your screen to learn more or even sign up today. Remember, we will have other cafecitos related to the All of Us Research Program and health topics, so please stay tuned. For more information about the program, you can always visit joinallofus.org/together. The information is available in English and Spanish, or contact us at NHCOA by calling at 202-347-9733. Please remember to keep following us on our social media platforms for more NHCOA content. So see you in our upcoming Cafecito con NHCOA. Bye-bye.